Hi everyone, this is Dr. Mrinalini Sharma, and we're back with a YouTube session after a really long time. And today we're going to be talking about a very specific topic, जो आजकल लोग हमसे पूछते हैं. We're going to be talking about two procedures which are used for reshaping our lips, and which procedure is suitable for which person. So we are going to be discussing two procedures today. One is lip lift, and the other is a lip augmentation. Now, whenever a person comes to me who wants some kind of a change in the shape of the lips, उसकी दो major concerns होती हैं. एक तो ये कि लिप जो है वो यंगर लगे, एंड द लिप ऑल्सो उसकी जो वॉल्यूम है वो अच्छी लगे. नाउ proportion wise, if we say, then जो लिप है, the upper lip should be about 2/3 of the lower lip. ये एक जनरल हमारा एक standard of beauty होता है, in which the upper lip is slightly smaller than the lower lip. So many people have this complaint that they have very thin lips, और उनके lips का जो volume है वो थोड़ा सा बढ़ाना चाहते हैं. This is also a problem which happens as we age. So जैसे जैसे age बढ़ती रहती है, जो आपका lip का volume है वो कम होता जाता है. So even if you had a good volume in your younger years, many people have this problem of the lip volume decreasing too much as the person ages. So lips जो हैं पतले होते चले जाते हैं. So इसकी, and some people also, even in young girls, we see that the lip volume is less. So the aim of doing a lip filler is to basically increase the lip volume, जिससे कि lips also, in addition to appearing just bigger, the lip also appears younger, it appears less wrinkly, and in some patients we also create specific lip shapes. Like some people like a little bit of pout in the center, वो भी हम create कर सकते हैं using a lip filler. Now, another procedure which is very popular for the shape of the lips these days is a lip lift. तो in this video I'm going to tell you कि हम कब lip lift करेंगे और हम कब सिर्फ आपकी lip की volume की augmentation करेंगे. So lip lift जो है, what is this? First I'll just tell you briefly as to what a lip lift is. As a person ages, what happens is ये वाला जो portion है आपके नाक और आपके upper lip, इसका जो distance है ये बढ़ जाता है. This can become long. So in older people you'll find that this length is long, ये लंबी हो जाती है, और लिप जो है इस तरीके से अंदर की तरफ रोल्ड होता है. तो ये जो सेगमेंट है इसको शॉर्टन करना इज बेसिकली व्हाट वी आर डूइंग इन द लिप लिफ्ट प्रोसीजर. सो जब हम लिप लिफ्ट कर रहे हैं, हम ये वाली जो लेंथ है इसको कम कर रहे हैं. इससे क्या होता है दैट आपका जो लिप है, जो अपर लिप है, इट काइंड ऑफ गेट्स आउटवर्डली पाउटेड इस तरीके से. तो इस तरीके से आपका लिप जो है बाहर की तरफ शो करेगा. So if you have a longer lip segment, जो upper lip, जिसमें मैंने बताया कि कुछ लोगों में aging के साथ होता है, and some people even in younger individuals ये चीज़ हो सकती है कि upper lip segment लंबा है, जिसकी वजह से जो lip है वो अंदर की तरफ rotated है. तो इस प्रॉब्लम को ठीक करने के लिए हम लोग लिप लिफ्ट करते हैं, जिसमें we'll be giving tiny cuts in the base of the nose, and यहाँ पे हम nostril के sides पे cuts देते हैं, जिससे कि ये वाली जो length है ये shorten कर दी जाती है. We're going to shorten this length and also help the lip to rotate upwards. Now this procedure indirectly also creates the impression of a bigger lip volume. So some patients will see that when we perform a lip lift on them, the lip now appears bigger also, in addition to the lip length, this length decreasing, and the lip also appears to have a larger volume. So this is very good a procedure for people जिनका जो change in the lip volume is simply because lip अंदर की तरफ roll हो रहा है as the person is aging. So as I have told you that this is more common in older people. When I say older, it can mean anybody in the late 40s onwards, but also in sometimes in young girls ये वाला problem रहता है कि ये वाला जो lip का segment है वो बहुत लंबा है, because of which the upper lip looks thinner than it actually is. Now, in such a patient, if a person has a long upper lip segment and we are simply trying to increase the lip volume using fillers, you'll notice that जो result है वो अच्छा नहीं आता, because volume तो बढ़ गई लेकिन lip जो है अंदर की तरफ इस तरीके से रोल नहीं है. तो वो जो lip की shape patient चाहता है कि अच्छे से वॉल्यूमाइज दिखे, अच्छे से पाउट आए, बीच का जो लिप सेगमेंट अच्छे से उसकी जो शेप बने वो नहीं बन पाती, बिकॉज वॉल्यूम जो बड़ी भी वॉल्यूम है, द वॉल्यूम विच वी हैव क्रिएटेड यूजिंग the filler still remains enrolled. It is rolled inwards and it is not really visible in the patient's face. So, if you're an older patient and you have tried fillers in the past and you're noticing that even after receiving 1 ml of filler or sometimes 2 ml of filler, your lip is not looking as volumized as it should be, then probably the problem lies in the length of the upper lip, and you need to consult your plastic surgeon and see whether you're a candidate for a lip lift. Now, in younger women जिनका ये lip length जो है वो छोटा है, it's not very long, and as I said, somebody in your 20s, then in this case, most likely the issue is in the lack of volume and not in the upper lip segment being long. So in such patients, we are going to go simply for a lip filler and not a lip lift. But as we age, as I said, if somebody approaches their 40s, then most of the times जो lip का जो inward roll होना, upper lip segment लंबा होना is the cause of the lip looking thinner than it actually is. Now, I'll tell you in brief about the advantages of getting a lip lift. And as I said, it can cause an apparent increase in the volume. It is again a one-time procedure. It is pretty much long-lasting. The results of a lip lift last decently long, and if at all you think that you need some more augmentation, you can always combine a lip lift with a lip filler sometime later on. So that's one advantage, that whatever filler now you're going to be putting in, if required after a lip lift, is going to be visible and it's going to produce the desired results. Now, जो स्कार है लिप लिफ्ट का एक इशू होता है that in the initial period you will have a scar which is going to be around your nostrils and at the base of the nose. Now this settles very well after say about 2-3 months. After 2-3 months, when a patient comes to me for the follow-up, this scar is practically not visible at all, and you get a nice refreshed younger looking lip. Now patients often ask me कि डॉक्टर कितना रेस्ट करना पड़ेगा, and how it is it going to cause a lot of problems in eating or drinking. So ऐसा नहीं है. This is a very short procedure which can be actually done under local anesthesia also. I can simply numb the area and give you a few injections there so that this upper lip is numb, and we can perform this procedure under local anesthesia also. We need not make you completely unconscious. जहाँ तक डाइट की बात आती है, जहाँ तक की बात आती है, so we'll ask you to be on soft diet for a period of about, I would say, a week or so after the surgery, and then you can gradually return to your normal diet. The other thing, which is obviously, is about the lip volume. Now, if you think that you need some more volume augmentation, then that can be done after you have healed from this surgery. And compared to fillers, the obviously this is a surgical procedure. The healing time is going to be there for about a week or so, and you might have a little bit of numbness in this area, which is quite common following a lip lift surgery. Now, 2-3 things which I would want you to know is that जो lip lift है वो अलग अलग extent तक किया जाता है. So an average guide is you can do something between a 4 millimeter to a 1 centimeter lip lift. तो वो जो decision है कि कितना lip lift करना है, how much we are going to remove, how much shortening we are going to cause, that the plastic surgeon is going to help you to decide that what is the kind of change you want and how it will look like, depending on how much lip segment we remove. So it is a range starts from about 4 millimeter to about 1 centimeter जितना हम lift cause करते हैं. Now लिप लिफ्ट जो है इसके रिजल्ट्स बहुत अच्छे होते हैं, इंस्टेंटेनियसली दिखते हैं. व्हेन यू फर्स्ट कम टू अस एट अबाउट 1 week, you notice that your face is looking much younger, the upper lip volume looks good, and overall it gives a very refreshed look to the face. Now, uh, sometimes patients have this concern that doctor surgical procedure क्यों कर रहा है, हम lip filler करा लेते हैं. But the thing is, if you are a candidate for a lip lift procedure, even if you were to introduce a lot of filler, जो फिलर है वो आपके अंदर की तरफ रोल होके रह जाता है. इट्स नॉट विजिबल एज अ nice augmentation of the lips. So the patient ends up getting frustrated that I've put a filler also, मैंने I've augmented my lips, and yet the upper lip है वो thin लग रहा है. It's looking worse. It's not looking nice. So this is where you have to understand that probably you're a candidate for a lip lift surgery, and simply a lip filler is not going to help. Now, as I said, the recovery is pretty much quick. It's about a week's time, and in 1 week we're going to remove all the stitches. जो निशान है वो धीरे धीरे they're going to disappear with time. We're going to be giving you ointments. We're going to be asking you to avoid sun exposure, and they settle very well by a period of about, I would say, 2 to 3 weeks. And when the patient comes to me by about 1 month or so, the scars are practically invisible. Yes, obviously, we are a little cautious in doing this surgery in a very dark patient, but in an average, even in a wheatish skin, the results are very good, and you hardly see any scars. लिप फिलर ऑब्वियसली जो है वो उसमें कोई स्कार्स नहीं होते, उसमें आपके जो सिंस वी यूजिंग जस्ट इंजेक्शंस टू क्रिएट वॉल्यूम, so this thing of scars and stitches are not there in a lip filler. So yes, if you're a candidate simply for volume augmentation and you don't require a lift, then we'll be choosing a lip filler and not lip lift. But as I said, if you're an older patient, if you're in your 40s or early 50s and you've had fillers, you're still not getting the desired results, then maybe it's time to your plastics and discuss this option of a lip lift surgery. And जो basic precautions रहती हैं, that is the same for any other surgery, that you should be avoiding things like green tea, alcohol, and smoking, say about 1 week prior to a lip lift surgery and a period of about 2 weeks post the surgery. It's not a painful procedure. You might have a certain amount of swelling in the lip following a lip lift surgery, which takes about, I would say, a couple of weeks to disappear. But 2 weeks is usually at the tops where the lip now looks nice and natural. Numbness ho sakti hai, that's quite common. That's again a temporary thing. It does not last very long. You might also have a sensation that you can't feel your lips or you can't move your lips initially. That's also very common. Thoda tightness lagna, thoda over rotated lagna, all that is a part of healing. Don't get scared, don't panic if you think that you're not able to close your mouth properly. That is just the numbness and the heaviness post surgery. So, and that will subside over a period of as early as 1 week. And sometimes we also combine the lip lift with another surgery. Say we're doing a rhinoplasty and we're doing a combination of the rhinoplasty with the lip lift surgery. So this is also very conveniently done, and it does not really add significantly to the downtime. Now, some issues can arise. As I said, the scar can be there, and maybe you also feel that the lip lift is too excessive. So we always counsel our patients that it's better to go for modest lifts. And then, if you think some years down the lane that, okay, you require a little bit more of a lip, then that can always be done rather than creating overtly shortened lip. So this is briefly about lip lift and lip augmentation, and the plastic surgeon is the best person to tell you what kind of a procedure you need depending upon your concerns. And if you have any other questions, joining me today, and I hope that you found this video useful. And for more such videos and for live sessions, please subscribe to our YouTube channel. Thank you for joining me today evening. Have a nice day.